I am again discussing a recall communications, that is epilepsy advice to the school nursery. It comes 2023 first day in Oman, also Jeddah 2023. So epilepsy advice to school nursery. The task is that advice for the nurse working in the nursery. There is a child 3 year delivered with periventricular leukomalacia and recently diagnosed epilepsy at fields, and it was scary for all. What I should do? Lateral position during feeds or after that. Also, what I will tell the other kids, they are so scary. Other nurse want to know. She want, I will give you websites and she can read and you can advise her. So nursery nurse, she wants to know about the epilepsy advice. So epilepsy advice, it can come like in directly epilepsy advice or can a breaking bad news of epilepsy. As usual, we are starting as an introduction. IRCP, introduce myself, making a report, taking the consent, telling the agenda, attendance, and the prior knowledge. How much do you know about Ali's conditions? Doctor, he is having epilepsy. I did not know anything. I'm afraid to do something wrong. Doctor, I want to know what can I do if he has these fits. So what he can do? The nurse that I'm really appreciate your worries. First of all, if he had the fits, put him on his side in safe and comfortable place. Also, you should remove any tight clothes or any accessories around his neck, and if he is wearing glasses, you should take it off. Are you with me? So what happen if the epilepsy fits occur? Then what happen? He will be his side safe and comfortable place. We will take him safe and comfortable place. We remove and tighten clothes and any accessories, especially around the neck. Wearing glasses, we will put off everything. Okay, doctor. Add to this, you will make sure that he will not hitting his head, but do not strain his head or flush his mouth with water, and do not put anything in his mouth. Am I making myself clear? Then we'll confirm that the child is not hitting his head and will nothing inside the mouth will put anything or any flush in water the face. Okay, doctor. And you keep watching him. If there is anything change in color, noisy breathing, and fits is prolonged more than 5 minutes, you will give him a medicine applied directly into inner side of the cheeks and then call the ambulance immediately. So you keep watching him. When there is an epilepsy occur, we keep watching him. If there is any change in the color, noisy breathing, remember fits is prolonged more than 5 minutes. These three things: change the color, noisy breathing, and fits is prolonged more than 5 minutes. We'll give him a medicine directly inner side of the cheeks and then call the ambulance immediately. Okay, doctor. So is there any home modifications I should do? What are the home modification of the epilepsy patients? Excellent questions. You should cover any sticking out furniture or sharp corner. So they will be cover the any sharp furnitures. Anything increasing the feeds? Yes. Sleep late, flush at night, fasting, menstruation, stress, anxiety, and heavy drinking. So stress, anxiety, heavy drinking, late night sleeping, missing meal, menstruation. These are anxiety, stress. These are increase the trigger the feeds. Anything else I should take care of? When using the toilet, better not to lock the door from inside and using a thigh from outside. During the shower, better to use it when standing rather than bath shower. So when inside the bathroom or toilet, they should not need to inside close the door. They can wear a sign, use a sign or thigh outside. And another is that standing shower is better than the sleeping taking bath shower. Okay. What about contraception? If it is she, if female girl, then contraception of epilepsy advice is actually not all types of epilepsy medicines affect the contraception. Some epilepsy medicine decrease the power of contraception and some not. So when she grows up, you can discuss with the sexual health clinic department and they will advise you about the best method of contraception for her and liaison with the nerve doctor. So about contraception is that we'll tell not all contraception, all anti-epileptic medications affect the contraception. Some. So when advice, go to the sexual health clinic and discuss in this matter. What about alcohols? Children with epilepsy cannot drink alcohol as it decreases the action and the efficacy of epilepsy medication and will make her prone to having fits. So children with epilepsy will not take medications, not take alcohol because it decrease the efficacy of the contraception of the epilepsy medicine and also increase the fits. What about choosing career? Yes, children with epilepsy cannot join armed force or air force. And driving license is that if he became free from fits for 1 year or having night times only feeds for 3 years. These are any problem if missed her medications all the day. So if any missing medication, what advice? It is important to take medication in certain regular times. Some types of epilepsy, if we forgot the medication, may precipitate the seizure, some others not. So need to take the medication regularly in the same time. And sometimes what happens, some type of epilepsy, if missing the medication, they start epilepsy, some has not. He always forgets the medications. We can use alarm, assign one to remember him, chart on his wall and tablet dispenser. So we can make a chart, we make an alarm, we can keep a person who can memorize that your medication taking time. Regarding school, he needs to be absent from school. Most children who have epilepsy go through the mainstream of the school, but sometimes epilepsy may disable the child to attend daily. We should liaise to the school nurse and make sure that they can deal with emergency situations. So, epilepsy patient normally maximum epilepsy patient going to the mainstream school, so we should need to liaise with the school nurse and what are the steps she can take. He playing the basketball, vigorous exercise better to be avoided, and if any other sports must be under qualified supervision. So vigorous exercise should be avoided, and other sports must be under qualified supervision. What about the traveling and camping for a long time? Better to be avoided traveling and camping long time, but we can assign someone knows his conditions, make sure he is having sufficient amount of medications and lies with the responsible for this camping. So he will take all the medication if he go he's traveling. And also someone who know what to do during this attack. Summary, trusted website, written leaflets, and support group. So these are the advice. I'm again just repeating. If epilepsy occur, what should we do? What are the steps? That is, first what happened? He had feet put him on his side, and safe and comfortable vessel will took him. We should remove all the tight clothes and any accessories, especially around the neck, and also wearing glasses. We should take off this. Then we'll sure that the child is not hitting head, and but do not strain him. Flush the mouth with water or anything inside. Put his mouth. Okay, and then we keep watching that if there is changes of the color, noisy breathing, and more than 5 minutes is continue, then we'll give the medicine applied directly into the cheek, inner side of the cheek, and call the ambulance immediately. So this is the steps we taken in epilepsy. This is all about epilepsy, which is come on 2023. Epilepsy advice to school nursery in Jeddah and Oman both. Thank you very much.